So, firstly, thank you to the European Patients Forum for helping us to co-design the session, to Tamsin for moderating, and to all the speakers and the audience, because everything you're going to see on the slides now came from you in the end. As some of you will have seen from the programme, the goal of the Patient Forum was for us to really get a look at where we are in patient engagement today, and for us as IMI, quite concretely, to get some ideas for how we can take things further on our side, both through our projects, but also for us as a programme office, as a research funding organisation. So our first session of the day was on what's the return on engagement for patient involvement. There's a quote there from Dominique Hamelink from the Longfonds in the Netherlands, who opened it, and she said, "Let's do it and not just wish it," which I think is a message we should all take away from today. So she gave some excellent examples from her area, from asthma research, where patient input actually, in often quite simple ways, made a huge difference to the way patients adhere to their medication, just because if it's not well designed, then they can't use it. And then we also have to the comment that we have come a long way, so we aren't starting from nowhere here, we're starting from a good position, but we do need to do a lot more, especially, for example, in the inclusion of patients from vulnerable groups. And we also need to make sure we're really doing this throughout the whole medicine's life cycle. Communication is a word that came up again and again, not just between researchers and patients, because that's the starting point for any patient engagement, but also between projects and programs so that they can share best practice. Because again, there is a lot going on, but sometimes word doesn't get out. So you'll have a small pool of researchers doing fantastic stuff, but if people don't know about it more widely, there's a problem. Another very important point is that we all need to step outside our comfort zone, patients, researchers, industry. And this comes again, this willingness to take risks, which is something we spoke about yesterday as well. In open innovation, if you really want to go far, you need to take risks and accept that there might be a failure. Another question that's a very important one is who leads the development of research agendas and where are patients in that? Education, again, is an issue that came up a lot during the day. Obviously, we spoke about patient education, and we heard from a lot of UPATI fellows during the day, and we spoke a lot about UPATI. But as a lot of people emphasised, we really also need to educate researchers in how to work with patients. There's a lot of willingness, but sometimes people just don't know how to do it. And finally, we spoke about the need to really change incentives, especially in academia, because a lot of them, they're judged on their publications. And, maybe they need metrics and key performance indicators on how they're engaging with other groups like patients. The next session was a big topic. It was big data. And my data are mine, is what Ilaria Passerini said during the day. And just before we get started, this is a massive, complex area, and we barely scratched the surface. And there aren't easy answers. But we did get some common points coming out of that. Obviously, there's the issue of trust. If you're giving your data, who owns it? And what are they going to use it for? What's the purpose of the research? Who developed the agenda? And also, in terms of benefits of research, there's all kinds of different groups there. There's the patients who are participating. But then, of course, a lot of patients, they're participating in research that probably will never benefit them, but it might benefit other patients in the future. What are the benefits for the researchers? They need their publications for their metrics, for the industry. And another thing as well with big data, and this is an important point, people often talk about it as the end, and it's not. It's a means to an end, and we have to maintain focus on what is the goal of the research. It's not to do big data. The goal is to use big data to achieve something better for patients. There's a big challenge, of course, in the big data field, and that's the speed of change. We heard from the Harmony project, which pointed out that they wrote up their grant agreement and all their project agreement, and they might have to change it in a year or two because the technology is moving so fast. One thing that is clear here is that we are going to have to work together on this because so many different people are involved and there's all new people coming in all the time. We didn't really talk about technology companies like Apple very much, but obviously they are all hugely involved in this area. And finally, there's the old maxim, rubbish in, rubbish out. Data quality is important. And the third session, if we can advance, voila. And here, this is about looking at innovative models of engagement. And here, this quote, "Make science more fun," is courtesy of Annette Backer of the Children's Tumour Foundation. Again, a lot of what was said in this session went back on what was said in the previous session. So we had the theme of reciprocity, what's in it for different people. questions of data, questions of trust, transparency, education came again, and of course openness. And again, there was a question, and there was quite a discussion about the representativeness of the groups. If we're only using patients from certain social groups, certain ethnic groups, is it really representative? Probably not. But how do we reach out to more vulnerable groups and really get them involved in a meaningful way? We briefly discussed the question of citizen involvement, which I think we agree is something that's important, and it's a complement to patient engagement. One very important point is the variation from country to country in the way patients are involved and the way their role in research, especially with regards to the pharma industry, is perceived. It's not the same across Europe, so one size will not fit all. A very important issue is how to compensate patients in a fair way for their work. Very often they're just treated as volunteers, they come out of love, out of care, and that's great, but it doesn't put a roof over their head. And if they're contributing their expertise and their knowledge and their time, they should be compensated. So how do we do that while also avoiding accusations of bribery, for example, if they're working with the pharmaceutical industry? We need to work these things out. Another point that came up, and this was made very nicely by Olivier Arnaud from JDRF, is that patient involvement is a science. And we need to share what we learn. And he also pointed out that success really breeds success. So if we share the successes, we can really help to spread the word on patient engagement more generally. And the media can also play a role here in helping to spread the good news. Another important point beyond the compensation is to really create an environment where everyone feels valued. And again, this comes back to communication, understanding what different groups want from a research project and what they need. And finally, Li Wenhua pointed out time is of the essence. Patients, they want something now, so we shouldn't be wasting our time chatting, we should be doing. So, 3 key words from today. Obviously, trust between all the groups and everything, and linked to that, all the openness, transparency. Linked to that as well, communication and collaboration. And let's do it. So, thank you.
Thanks a lot, Catherine, for that great summary. So same thing, contributions from people who were in the room, questions from people who were not in the room. Any comments or questions for Catherine? Yes, one.
Do you foresee the chance to incorporate policymakers to the IMI projects? Let's say, for instance, regarding data sharing and data safety, I think it's important to have them in, because sometimes what we can see is that with new regulations, they are putting sticks in the wheels.
Well, I think there's no exclusion criteria for policymakers not to be involved in IMI projects. In fact, we encourage them, and we encourage the projects when the consortium, when they're being created, to include policymakers. And I think like each of the stakeholder groups that we try and encourage to join us, they're very, very important a group of people. So I think, now, that's not to say that maybe we don't have enough policymakers involved in some of our projects, but there's absolutely no reason why they shouldn't be. Any other comments or questions? Yes, there's another one.
This is somehow indirectly related to the patient engagement, but we are going to create a lot of databases in various IMI projects, and what we also discussed internally, so I'm from Bayer, is the sustainability of these databases, the access to the databases after the ending of the public funding and so on and so forth, to make use out of these data and to provide them either for the planning of clinical trials and so on and so forth.
Yeah. Great topic. We are very concerned about the sustainability of some of these databases, And there are some European infrastructures that are available to us, like Elixir in the case of databases. And I know that somebody wants to come in there. Somebody from Elixir, right? So I'll just say a very few words and then it's over to you. So I think there are options, and we're now more insisting on projects and consortium that they think of this real issue right at the beginning of their project and not, when it's coming to an end and there's a bit of a cliff going on. But I think somebody wants to come in from Elixir.
Hello. Yeah. My name is Pablo Roman from Elixir. So I was going to reinforce that idea about the getting in contact with experts within infrastructures. Either it's Elixir for data or sometimes it's biobanking. So we have colleagues from BBMRI or even clinical trials from the very beginning, because that's important in order to plan accordingly. And the other comment is we just recently published the Elixir recommended deposition archives. So basically large archives where you can deposit your data. And actually that's pretty beneficial to many topics we've been discussing these days. For example, sometimes these archives, they encourage you to use machine-readable formats. So it's actually very friendly for artificial intelligence projects or for the future. So and then we also have core data resources, which are bioinformatic resources, which are essential for the community. So all those resources and tools are available for the community. So please go ahead and contact Elixir experts, either me now or experts within the community. We'll be very happy to help. That's what infrastructures are for, basically. So yeah, thank you.
Thank you very much. Thanks a lot. Any other comments? Yes, there's one here.
I just wondered if there's been any clarification, unfortunately post-Brexit, what will happen with UK funding for IMI? Are we still allowed to be partners?
So,
nothing but a controversial end to the...
Yeah, for sure, yeah. And it's I hate talking about Brexit, to be honest. It just makes me sick. For us, it's a lose-lose, right? No question about it. So it's just a very unfortunate situation. We don't know exactly what's going to be negotiated, right? The line, the official line is, for the moment, business as usual. People should be encouraged to apply from the UK, and people should be encouraged to partner and collaborate with UK individuals and institutions and so on and so forth. Having said that, there was just the other day a flag put on the Commission website saying that UK participants in projects in general across the European Commission are not guaranteed continued funding beyond March 2019 if there is not a deal made. Right? So it's a very unfortunate situation. I really hope, I'm optimistic that some deal will be made. It won't be easy, and it'll be in a larger context. It won't be a deal made just on this particular item. But it would be a great loss to the UK and to Europe if we didn't find a solution.